Hello, Dr. April with FEHM Public Health and Wellness. I am going to hop on starting almost every week now and talking about different topics that apply to patients and pelvic floor issues. So today we're going to talk about constipation in kids and adults. So what we're going to do here is kind of go over like what is constipation and then how does pelvic floor physical therapy help. If we talk numbers, 1 in 5 kids have constipation, um, up to about same amount in adults as well. And women tend to have more constipation issues than men. And over half of people with constipation have a problem with their pelvic floor issues called dyssynergia or pelvic floor dyssynergia, where their muscles actually want to tighten versus relax. So I have the pelvis here. Here's the pelvic floor muscles on a female. Okay. This muscle around the anus is called the external anal sphincter. And what we do in therapy is we see this muscle. And when we ask patients, like, gently bear down for me, we're seeing what this muscle does. And does it actually tighten, like tighten in and up towards the head like a Kegel? Or is it opening for a bowel movement to come through? And what we often find is that this muscle is actually tightening in people with chronic constipation. So constipation, yes, it is a digestive and gut thing, but it's not always just a diet problem. It could potentially be an issue with the pelvic floor muscles. Um, and so pelvic floor dyssynergia isn't rare, and it's not just about increasing fiber or water in your diet, but sometimes those do play a role if we're not getting enough water or enough fiber, but we don't want to just keep throwing fiber at the issue. So, what's actually happening with a bowel movement? Those muscles lengthen and relax down so we can get that stool to go through. But what we're seeing is people are actually tightening those muscles. So, this can lead to issues such as straining, pain with bowel movements. If we look at our Bristol stool chart, sometimes what we'll see with constipation is like this number 1, like little rabbit turds, or number 2. We want more ideally like a number 4, soft to pass, snake like, easy. Some of our patients are reporting abdominal pain, especially our kids. They get abdominal discomfort, feeling like they're not fully emptying, sitting on the toilet for up to 20 to 30 minutes. And we always want to rule out constipation with our patients having urinary issues because constipation will put pressure on the bladder and cause bladder issues as well. What we see in kids or toddlers is them withholding stool, kind of hiding to poop, smearing in their underwear, or actually like bowel accidents. So, how do we help with pelvic floor physical therapy? Great question. So, we're looking at several different things. We are making sure they have muscle coordination, that they can engage those muscles, but also drop them down and relax. We're watching breathing. We talk about toileting posture, abdominal pressure management. Can they engage abs enough to put pressure down? And then behavioral habits. We talk about time toileting, nervous system regulation is part of this as well. So we want to teach the body to relax during bowel movements. And for kids, we want to make it playful and education based. And then for adults, we're working on retraining patterns that likely started during childhood. So, some tips to try at home. I do highly encourage pelvic floor PT, but some tips if you're listening is using a footstool or a squatty potty, getting those knees higher than the hips, breathing on the toilet, slow, deep breath in through the nose, in for 4, out through the mouth for about 6. Don't hold your breath and strain. We also don't want to sit longer than 10 minutes. Don't force it. And address constipation early in kids. And if you're listening to this and you have a kid, we don't even want to start potty training until constipation is fully eliminated. The longer constipation goes on in kids, they can actually get a megarectum where they stop feeling the urge to even poop, which leads to more issues. And we don't want stool sitting in the rectum because water keeps getting drawn out and it gets harder. So remember, this could be, in about 50% of people, this could be a pelvic floor muscle issue rather than just a fiber, water, activity level issue in what you're eating. So if you or you have a kid or a grandkid struggling with constipation and the typical things aren't helping, feel free to reach out to our clinic if you are local. If not, try to find a really good pelvic PT. PT near you. We are located in Central Southern Illinois in Effingham, and we're more than glad to help those in Illinois. We do telehealth visits as well. So reach out to us if you need to schedule an evaluation, and I hope you guys find this helpful because a lot of people just think of constipation as poor diet. We need to increase fiber and water, and like I said, it could be your pelvic floor muscles just are not coordinated enough, and we need to train them. Thanks for listening.